Good morning. It is January 5th, 2023. I'm Jessica Lovell. Welcome to the new year. We called this news conference to keep a promise that we made back on October 5th of last year, and that is when we first announced a letter of intent for Olathe Health to join the University of Kansas Health System. We promised we would reach out when we had an update, and today is that day. The due diligence period is complete. We have signed a final agreement, and today we officially welcome 2,400 Olathe Health employees, 350 providers, and 250 volunteer ambassadors to the start of something really great. During this conference, reporters will have an opportunity to ask a few questions to the University of Kansas Health System President and CEO, Bob Page, the President of the Kansas City Division, Tammy Peterman, and Interim CEO of Olathe Health, Jason Hannigan. They are all together at Olathe Health, meeting with various groups as we speak. And that is also where we find Alexis Del Cid. Alexis, good morning. A lot is happening down in Olathe this morning. What's been happening out there, and how would you really describe the reaction to this official big news?
I would say in a word, Jess, the reaction is celebratory. I mean, the message here is simple, but it's so powerful, and that is welcome. Welcome to the University of Kansas Health System. This is very exciting. We have Bob, Tammy, and Jason who began their meetings early this morning with leadership and physicians and other employees. This is a huge morning here at Olathe Health to tell them the news. Now, you might recall Olathe Health is comprised of two nationally accredited hospitals, Olathe Medical Center, that's where we are standing right now, and Miami County Medical Center in Paola, Kansas. There are also 60 care locations that are all becoming part of the University of Kansas Health System. Welcome to the family, right? Joining us now, we have Bob, Tammy, and Jason, who are on their way to another meeting, no doubt. We want to take a moment to chat with them real quick, just a few minutes. Bob, I want to start with you. What are you saying as you officially welcome new employees into the family?
Well, Alexis, you took my line. It's welcome to the family. I mean, it is a phenomenal day here. I'll tell you, we've had the chance to be down here the last couple of days talking to everybody possible, and the enthusiasm is palpable. It has just been so exciting to be here. You know, I'm a CPA by background, so I'm going to do a little math for you. This is a 1 + 1 = 3. This is not 1 + 1 = 1.5. This is coming together of two phenomenal organizations. We've worked together previously in vascular surgery, in plastics, in urology, and today just marks a brand new beginning for all of us, and couldn't be more excited about welcoming Olathe into the family.
Tammy, I want to come now to you because you also have an important message as president of the Kansas City Division. I know this is all about joining our teams together this morning. Do you have any insight on what patients can expect?
Absolutely, and I will talk about that. I also want to say we're so excited about welcoming the Olathe Health System into the University of Kansas Health System. And I will tell you, when I spoke to a physician just earlier today, I said that, and he said, he was a physician from Olathe, he also said, and welcome to Olathe. So it's a great time down here. People are pretty excited. It's great. So here's what I would have to say to patients. Nothing is going to change substantially right now. We're going to be going through an implementation phase. We're going to be really learning more about one another, and then we'll work on the integration, and then we'll work on implementation. And right now, I think that the two priorities we'll focus on initially will be at 151st and Quivira, an ambulatory surgery center, as well as some ambulatory areas, but also our cancer program. We know it will be so important to bring the KU Cancer Center to Olathe, and we'll be doing just that.
This is also a huge morning for you, Jason. We know you've been up very early. What have you been talking to people? How early did you start, and what's been your message to employees?
The excitement is real. It's been a long time coming. I think our providers and our associates and other supporting leaders are extremely excited. They're really excited to meet Bob and Tammy and their leadership team, and that relationship will continue to unfold for weeks and months to come as we work diligently to bring more care close to home for our patients. But the excitement is very real.
You're going to have a good time working with Bob and Tammy.
Absolutely.
We do. We love them. Well, thank you for taking a few minutes to talk with us. We'll check back in with you in a little bit. I want to toss it back to Jessica Lovell in the studio. Really a special morning here. You can just feel it in the air.
I bet. Yes, very exciting. I love that whole theme of welcome to the family. Alexis, I want to take a quick moment and check and see if we have any reporters on the line. Any questions for Bob, Tammy, or Jason? And if you do have one, please state your name and your organization. All right, well, while we wait for reporters, and if one jumps on, please jump in. But after welcoming everyone today, I think we do have a reporter. Please go ahead. We're just waiting, I think, for the reporter to jump on here in just a moment. Want to give them just a moment here. Okay, so while we're waiting for reporters, we do have a couple of questions, Alexis. I'm going to just head out there and let Bob, Tammy, and Jason jump on these questions for us. But after welcoming everyone today, what will be the next immediate steps for integrating all of these new great employees that we have?
The next immediate steps for integrating these fabulous new employees?
Well, actually, that work starts right now. We've already talked to our teams about getting individuals from the University of Kansas Health System and Olathe Health together to work on that integration plan. We're going to be doing that as early as right now. We started some of those meetings actually early next week as well. So we'll be developing that plan. We want to have that integration plan completed, hopefully in the first quarter of calendar year 23. Pretty aggressive timeline. Once we do that, we'll help identify some of the priorities we'll be working on together. We're pretty excited, and the individuals who are working on those integration plans, they're pretty excited too, because they get to work together with individuals from both organizations who are coming together for a common good to make sure that we can increase access, make sure that we can provide that seamless care to patients. It's a really great thing.
Tammy or Jason, two great organizations we know coming together creates a lot of work in joining those people, as you just mentioned, but also a lot of processes and other things that have to all line up. Is there a timeline of when everything will be fully integrated?
I think the point and the concern is valid, but I think you'll hear consistently from us, we're going to take as long as necessary to make sure this is right for everybody, with the focus on our patients and our community first and foremost, and our associates and our physicians. And so we're going to take the time, but the point is, through integration planning, we're going to collaborate together for a vision that puts our patients first for the future and generations to come.
So we know all today is about welcoming new employees, but anything that patients need to know or do right now?
I don't think there's anything specific patients need to do right now. They need to continue receiving the care in the locations they've been receiving care. We'll make sure that we continue to update patients if things would change, but right now, patients can get the same great care in the locations in which they've been receiving that care.
Stan Holm is the former CEO and president of Olathe Health. Where is he?
Stan and the University of Kansas Health System recently have mutually agreed to part ways. Stan's leadership has been great to this whole point, and for the last 4 years, our focus has been bringing care closer to home for all of our community. And this relationship today culminates that whole goal.
Will the signage at Olathe Health change? What will that look like?
We will have new branding at Olathe Health. We don't know what that will look like exactly. We know that we will have the University of Kansas Health System name on the Olathe Health buildings. We don't have that yet, but stay tuned because we will.
Before we head back out, Alexis, to you, I want to just check and see if there's any last call for reporters on the line. All right, Alexis, let's check back in with Bob, Tammy, and Jason. I just really want to hear their final thoughts. I know that's such an exciting day, but let's get this wrapped up and hear from them once again.
Okay, let's start with Jason. Jason, do you have any final thoughts or messages as we wrap up this news conference?
Yeah, I think it's really important to know our leadership team here at the Olathe Health community has been focused on bringing care and enhanced care close to home. We've developed a great relationship over this 4 years with the University of Kansas Health System. And again, this really brings the best thing for our community for generations to come. And we expect to have enhanced care going forward to keep our patients close to home where it's best for them to be served.
I want to hit up Tammy now. You've had a big smile on your face all morning. You must be exhausted, but you look so happy. You're glowing.
Thanks. You know, what I will tell you is that there is great excitement and great energy in the air. It's been really fun. Someone called me during one of our meetings that we had. We had a meet and greet breakfast this morning, and I said, this is unbelievably fun because people are excited. They know this is good. We know we have a lot of hard work ahead of us. That's just fine. We're going to do the right things. We're bringing some of that care, additional care, to a community that has already great care. We're going to expand the footprint of the University of Kansas Health System. This is a great day for Olathe, for KU Health System, as well as our entire community.
Bob, why don't you close us out? Take us home, Bob.
Yeah, well, it's hard to follow these two, but I'll say a couple things. One, when Tammy and I had the opportunity to talk to people in the community about this transaction, the number one word that came out of everybody's mouth was wow. I mean, this is truly a game changer for healthcare in Kansas City and the metro area. And we are so honored and privileged to be a part of that. I was at a reception this morning. I was talking to a physician and I said, you know, it would be kind of fun to put a time capsule in the ground with all of our predictions about what the next 5 to 10 years hold, and then pull it back out and see how much of those actually came true. My guess is we will far surpass anybody's expectations about what we can accomplish together. So I, for one, am just so excited about it. I love the energy down here. I love the team that's joining our team. I think we've got some phenomenal things ahead in our future.
Super exciting, great messages, and thank you all for taking the time to speak with us this morning. I know you're super busy. You have a lot more meets and greets and people to see and places to go, so we're going to cut you guys loose so you can go back to doing what you need to do. Thank you so much, and thank you for joining us. Jess, I'm going to head back to you in the studio now.
Exciting spot to be this morning, Alexis, for sure. Thank you so much. Want to check one more time to see if we have any reporters? All right, well, this will conclude our news conference. We will upload this to medicalnewsnetwork.org here in just about an hour, so check back with us then. And thank you for joining us. We will see you back here tomorrow at 8 a.m. for the Morning Medical Update. Have a great day.